center, then your right central lobe, or right medial lobe, and then right lateral lobe. Over here is the left central lobe, left lateral lobe, and then the caudate lobe is back here, so you can see it sticking out there. And then the falciform ligament was attached to the anterior side of the liver, so yeah, there's a good piece right there. And the gallbladder is between your quadrate and your right central lobe, so you can see it kind of looks like a deflated balloon between those two lobes. And then the bile duct is the part that attaches our gallbladder to the duodenum. There's the end of it right there. And then the esophagus is going to be up at the top of the stomach. So if we find our stomach and see where it's attached up here, let's see if I can get my probe under the esophagus. There it is. So that's the esophagus. And then the stomach, if we were to cut it open with some scissors, you can see the rugae inside. So those are just folds that allow the stomach to expand. So you can see some of them. This one has some food. It was already pretty expanded, but the rugae are the folds on the inside of the stomach. And then the greater curvatures on the bottom of the stomach, the lesser curvatures on the top of the stomach. Thank you. And then the pyloric sphincter and region is down here at the end, right before we get to the duodenum, or the duodenum. So that's the first part of our small intestine. And then the middle part of the intestine, so it goes into the jejunum. And then the last part of the small intestine is the ileum. And so this would be our ileum here, and then there's our large intestine going straight down to the rectum. The spleen is this organ here, large intestine, and rectum would be inside this pelvic cavity. So if we look behind the vagina, there's one more tube, and that's the rectum. And then the anus is the opening of the rectum. The mesentery proper is this membrane that has blood vessels in it. The hepatic portal vein is going to drain, well, let me do superior mesenteric and inferior mesenteric veins first. Let's see. Yeah, so here's our superior mesenteric artery, and then right beside it is the superior mesenteric vein, and then your inferior mesenteric vein is right here, draining the large intestine. And then your hepatic portal vein is where your inferior and your superior meet up. So here comes superior, and then there's inferior right beside it. So they meet up and go to form the hepatic portal vein, which goes to the liver. The celiac artery is a branch off the abdominal aorta, so if you come all the way over and pull everything to the side and scrape this loose so you can find your abdominal aorta. So you can see the abdominal aorta there and there. It has two branches. The first branch right there is the celiac artery. Sometimes it's called the celiac trunk. So that goes over to the stomach and the pancreas. The second one is that superior mesenteric artery. And then abdominal aorta, abdominal vena cava is usually right on top, right there. And then the abdominal aorta runs beside it or underneath it. And then the iliac branches, looks like the aorta kind of comes around. So if we follow our abdominal aorta down here, you can see how it starts to branch. So our external iliac would be these two main ones. And then the veins, the iliac veins, would be the first big branch of the vena cava. Right there. So there's one branch and then the other branch is under, it's under that pink one. And then the renal veins and arteries are attached to the kidney. So there's a renal vein right on top. Here's the renal vein for this kidney. And then the renal arteries are right underneath. So there's a renal artery. And testicular, you guys wouldn't have any, but you have an ovarian artery and the ovarian vein going over to the ovary right there and the oviduct. There's your uterine horn and uterine body.